Welcome to Return on Insights, the show where candid conversations with bold founders and leaders spark actionable insights for your business. I'm David Lindover.
And I'm Erin Abitangelo. Each week, we pull back the curtain with leaders who are scaling teams and shaping the future, sharing the insights that create impact far beyond the bottom line.
Discover how high-performing companies build enduring cultures, inspire teams to think bigger, and turn vision into action. If you see storytelling as your strategic advantage, you're in the right place. Welcome to today's episode, Transforming Healthcare Communication, the Human and Digital Imperative. I'm David Lindover, and our guest is Bipan Chand, Chief Medical Officer at HealthNautica, and a nationally recognized leader in gastrointestinal surgery. With decades of experience at top medical institutions, Dr. Chand brings unique insights into the ongoing challenges of healthcare communication. In this conversation, he shares how his clinical journey and leadership at HealthNautica are driving the shift from paper-based systems to digital, patient-centered communication platforms. Join us as we discuss how tech and the human touch can work together to improve patient experience, reduce provider burnout, and enable real transformation in healthcare. Welcome.
Thank you, David, for having me.
I'm looking forward to our conversation. My first question, what personal experiences as a clinician and leader most influenced your passion for improving healthcare communication?
Yeah, I've been in healthcare, David, for the last 2.5 decades. And when I first started out, I was heavily involved in patient care, and that was my primary focus. And as time went on, I quickly realized that in order to have good patient care, you have to be able to look at the entire healthcare delivery model. And that really got me interested into technology-based healthcare delivery.
Okay. So how did you identify the specific communication gaps that HealthNautica seeks to address, and how have those gaps evolved over the past 2 decades you've been in the business?
Well, certainly, I think technology in general has evolved in the last 2 decades. In the past, the way we communicated with patients, with hospitals, and with various other entities that are involved in healthcare was typically through phone calls or faxing, and that really led to significant workflow inefficiencies, challenges for all providers, hospitals, and even patients. And so, with these new evolving technologies, we looked to try to make that much more efficient workflow for all different stakeholders.
In your view, what are the most significant barriers, technological, cultural, or organizational, to achieving these seamless communications that we're looking for in healthcare?
Yeah, I think the biggest barriers, I think, for physicians is being able to adapt all the new technologies. And for healthcare systems, it's being able to see if there is one and only one platform, which truly does not exist. And I think that's the reliance on healthcare systems, is looking for that one platform that can really address all the challenges and the barriers that we have. And I would say that there really isn't that pie in the sky platform out there. And so I think healthcare systems have to look at technology and carefully evaluate what they have in their own technologies and what they are lacking, and then give it a fair assessment. And I think that's what we try to do.
I appreciate your candor. Can you share some examples of how HealthNautica's platform has improved patient outcomes or provider satisfaction in real-world settings?
Yeah, absolutely. I think we all know that there are significant challenges in healthcare today, from provider shortages. I think that's one of the biggest things that we see. And so, how do we try to avoid some of the things that lead to physician burnout? And so, what we try to do in HealthNautica's platform is try to provide a service that allows for better communication from physicians and physician offices directly to hospitals as well as directly to patients. So that communication piece, I think, is what we really have focused on. And today, most patients really utilize their cell phone for being able to receive information and communicate information back to either hospitals or to physician offices. And that's what we've really leveraged on, is that tool that is readily available for almost all patients and also hospitals.
Makes good sense. So how does HealthNautica approach customization for diverse patient populations, such as language or literacy needs? And why is it critical for digital health success?
Yeah, you're absolutely right. I think one of the challenges that we find is there are significant language barriers, and not only language barriers, but it being able to communicate at the appropriate level of education or fund of knowledge to your patients. And so, what we've developed are tools for physicians and offices and patients that are really language specific. So, you're now able to schedule and also provide information and instructions to patients in that appropriate language at that appropriate level as well.
That's great. What role does two-way real-time communication play in reducing surgical cancellations and improving operational efficiency?
Yeah, I think that's the key to having effective communication is being able to communicate two ways. And so some of the inadequacies of prior communication really relied on telephone calls with interruptions or faxes with missing key elements. And so, with two-way communication platform as what we have in HealthNautica, you're able to see and track how each system is working. So as patients interact with the platform, we're able to see that in real time, and the platform is able to allow communication directly to the physician office and at the same time the facility. So that two-way communication is able to augment the person, and it allows for adequate learning. So it really provides a easy way for scheduling and obtaining really optimal performance.
So when HealthNautica is seeing that information, what does that look like as the communications are going on?
Yeah, so what we're seeing in our portal is a interaction tool. As a patient is receiving information or scheduling, we're able to see and track as those patients are reading the text, responding to the text. We're able to track and upload additional information for the patient. So what we try to do is not overwhelm a patient with all the information at one time. We give them graduated information as they get closer to a procedure, for say. So they are able to respond that yes, they're still planning on the procedure. And then as we get closer to the procedure time, they're given detailed instructions on how to best prepare for that procedure as well. So over time, we're able to see that the patient is responding to the information. The hospital is able to track that they're responding to the information. And so we're able to make sure we have an engaged patient that's going to lead to hopefully not a cancellation for the physician in the hospital.
Makes good sense. I can think of many occasions, myself and family included, where there was a shortage of information and a difficulty finding and reaching the right person who can supply the information. So the anxiety level was unnecessarily high. It sounds like a great solution for that. Let me carry on, though. How do you measure the return on investment for hospitals and health systems that adopt these digital communication solutions like yours?
Yeah, absolutely. I think most hospitals look at KPIs or key performance indicators, and most of that relies on efficiencies in the procedural areas, in particular operating rooms or other procedural areas. So, how do we avoid 24-hour cancellations? How do we allow for physicians and hospitals to make sure that everyone is on the same page when it comes to equipment needs, when it comes to start times? So all of those are built in to that portal. So we're able to communicate with the patient and the physician to when they're expected to be at the hospital, what equipment is necessary. We have a tool that allows the hospital to respond to vendors and make sure that the appropriate equipment is readily available for the physician. And so those are all built in. So that communication goes to multiple different physicians, nurses, vendors, and hospitals, as well as the patient. So that seamlessness allows for accuracy and then avoids any delays, avoids the wrong equipment as well.
Wow, it's truly comprehensive. Looking ahead, what innovations or trends in digital health communications excite you the most, and where do you see the greatest opportunities for impact? And then to add to that, what's the future for HealthNautica, and the additional functionality that you're looking at for the system?
Yeah, I mean, I think it's hard to predict what the future is going to look like, but what I think it's going to look like is we have a great communication tool. We are able to look at workflow and try to automate it. But I imagine a system that really combines artificial intelligence that allows us now to look at the data that we're acquiring and then to utilize the artificial intelligence platforms and all the simulation to really give even better deliverable care. And so the patient workflow, the scheduling capabilities will allow hospitals, healthcare centers to achieve and sustain all the peak operational performances, and at the same time improve patient access, the clinical outcomes, and financial performance for our systems.
Very informative conversation. Is there anything else that you'd like to tell our viewers about the HealthNautica, or anything in the future? You mentioned, I know that it's hard to predict, but anything that you want to go out on a limb?
Yeah, I think I go back to what our primary goal in healthcare is, and that's really delivering excellent patient care. And I think if you keep the patient at the center of your healthcare delivery, and that's your focus, then I think we're all going to achieve that. And yes, we'll have to work through the barriers that we all perceive in the future when it comes to constraints with our physician and ancillary staff shortages. But I think utilizing technology is going to only help us improve that.
I enjoyed our conversation, Bipan. Thank you so much. Appreciate it.
Thank you, David, for having me.